I can hear you, sir.
So if sometimes there's a lag or an issue, please let me know
Sure, sir.
because AirPods will remove the sound. So that's why. Okay.
So, with all your due permission, we are beginning with the session for the day.
Okay.
A very good evening to one and all. This is Batul from IGCP, the moderator for today's session, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by our renowned stalwart who is present here with us today. Well, sir needs no introduction at our platform, but yet it's our great pleasure and honor to introduce him. He is none other than the very renowned Dr. Manohar Kain, sir. Sir is MD, DNB, MNMS, Triple FRCP from Edinburgh. Sir is consultant physician at Manipal Hospital in Bangalore. Sir is also the clinical examiner at MRCP UK PSES. And with this, we would like to welcome Sir for the talk for the day, which is on the topic of physical activity as a pill, a new paradigm for diabetes care. So now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin. So over to you. Please proceed.
Thank you very much and namaste to everyone. It is a great pleasure. I hope I'm audible, visible, and hopefully my screen moves and we won't have any issues on the technical front. But if there is something, you please let me know. I think it's a great day. I was always been a big fan of Med Talks, IJCP, especially Agarwal sir, who was telling us so much sharing information for all of us. Especially, I was glued to him during the COVID time. And when I got a mail from same body, I was very thrilled to be a part of it. So exercise is my passion, and of course, lifestyle therapy is important. Lifestyle diseases like diabetes, obesity, hypertension, everything requires primarily lifestyle solutions. So that is my mantra in dealing with lifestyle or metabolic diseases. So today's topic, what you've chosen is a physical activity as a pill, a new paradigm for diabetes care. I think the cartoon is not moving. Otherwise, on to the right of your screen, if you see there's a pill which is exercising. So many times people think that if exercise and diet could be prescribed as a pill, it would have been much easier to take because getting motivated, starting on to something healthy, and staying there, that self discipline is not very easy. So, with those words, I'll start on to the presentation. Well, lifestyle is a controversial topic. I am not an authority on the lifestyle. I'm not even a six packer, not an early starter like many people from childhood. They do the exercise, but I didn't. I started only since 10 years. But if someone who is very like a six pack, sculpted body talks to you, it may be difficult to correlate to that. In a busy schedule, a doctor or any other profession or someone who's suffering from the disease, or even not, you don't have to suffer from any disease to become healthy or think about healthy or being changes in the lifestyle. If you are to survive and lead a healthy, happy life, health is the biggest wealth we need to do that. So, if I can get into fitness at this age now, anyone and everyone can and should is my motto. So, I'm sure all of you would understand and express the same emotions with me that exercises are underutilized. Definitely, yes. Because even though we read a lot about it, we know about it, somehow we still underestimate the benefit of exercise. One way of getting into that rhythm is by experiencing it. Secondly, lack of training in exercise therapeutics. Even as doctors, we all are trained to treat illness. We do learn some amount of wellness in the early part of our career, where we are finding it very difficult actually when we get into the medical school. But illness is what we look at and chase rather than wellness. Of course, things are changing nowadays. And there is no financial reimbursement to the patient. So everyone wants a reward and an immediate reward, not a waiting time reward. And also, of course, nowadays we have some data coming up, but definitely large randomized controlled trial of our data are lacking, like how we have for other medications with respect to lifestyle, exercise, and nutrition. We are looking at it definitely nowadays a bit more seriously than what it used to be, but then it is still lacking. So these are the some newspaper cuttings which we all know. Every second Indian adult physically inactive and fails the WHO guidelines. We'll come to the WHO guidelines later in this presentation. So, one in two of us are not up to the guidelines itself, and half of all adults in India are unfit, and women are most physically inactive. Of course, they have the burden of carrying the family, and also so many people also do work. And another important point, what is there is it's time that we Indians stop glorifying overwork. We do that especially in our medical field, and of course in many other fields also. We are more happy to say that I worked for 12 hours, 16 hours, I saw 100 patients, or I was on a project work for continuously, not slept for 2 3 days, been proper, I hardly got any rest, and we are very happy and proud about it, but that is not the way to go ahead. And if you look at the doctor's perspective, alarming survey results, IMA has seen clearly life expectancy of the doctors is lesser, almost a decade lesser as compared to a common man in India. And if you want to look at the right side of the screen, not doesn't show as well. It says it's a bitter pill to know that 20% of doctors are obese. Maybe it is more than that. More than half of us are diabetics, and more than one fourth of us are hypertensives. Of course, some of the things could be inevitable, but do we have to care as much, if not more, than what we advise to our patients? So, lifestyle and wellness is an enormous topic. When they suggested, I thought we'd speak on lifestyle as a whole or a wellness as a whole, but it is a big topic encompassing environment. Nowadays, pollution, including the noise pollution, also is playing a lot of part. And of course, in certain places like our capital, sometimes the fog, smog, and the environmental pollution is not only increasing the respiratory illnesses and malignancies of the cancers, but also it is increasing the incidence of diabetes also. So environment is very, very important. Nutrition, of course, is most important. If you want to look at the wellness and if you want to pick one of the factors, it should be nutrition on top of our charts. Technology has become inevitable. Everywhere technology is there, and we need to embrace the technology, but to what extent? And what was thought to be useful should not become a mayhem or a cause of concern in our life. Imagine laptops and desktops were or computers were originally invented to make our life easy. But of course, it has made our life easy in a lot way, but it has made us busy also. Otherwise, generally, when we talk about lifestyle and wellness, we always talk about the physical activity, sleep, stress, and of course, the behavioral changes, including the habits. Today, we will focus on lifestyle as a prescription. I think the animation is not coming in this slide, but it doesn't matter. So, when you look at a person onto the right of your screen, where we can clearly see uh, that when you or someone is trying to talk about lifestyle changes, there are hardly anyone who take it. And of course, pills and surgery, many people are there. And if you just tell your patients at the beginning of my consultations, I also used to write like what is written here, like diet and exercise to almost everyone. But if you're not specifying and analyzing in which state the person is already and how much more exercise he needs, it is as bad as a prescription as to on your left of your screen where someone has written some antibiotic or painkiller for 3 days. So what I'm trying to say is it is individualization and precision care is the way forward even when you talk about medications or also lifestyle measures. So, my talk will generally go on these principles, types of exercise, intensity of exercise, benefits, glucose and exercise in particular with respect to healthy and also in diabetics. How do we monitor? What does the guidelines say? And the last and most important thing, exercise nowadays is a prescription. We should not just say do exercise or do the diet. We need to tell them. And how do we do it? We'll learn it in the future slides. So, what is exercise or a physical activity? Is something more than exercise. We must have seen a lot of our friends, or at least few of them, who do intense workout for half an hour, 45 minutes, up to an hour a day, but they don't seem to have benefited much because the remaining 23 hours they are not focusing on being healthy or active. So, exercise is not just what you do in your gym or at your home for an hour of yoga or whatever type of exercise, but also what we do with ADL, the activities of daily living, and everything put together forms exercise. So, what do you mean by exercise? It is a subset of physical activity which is planned, structured, and repeated regularly with a discipline and also with a purpose. So many times I prefer to run and I train for marathons. So that exercise subset is slightly different if I'm trying to gain weight by improving the muscle mass or try to relax by looking at meditation and yoga as an integral part of exercise. So, important point to note, it should be planned, it should be structured, repeated regularly, and with a purpose. What is your purpose? You want to lose weight, you want to gain muscle mass, you want to become more flexible, you want to look more calm, or so on, or run a marathon, or a cycling event, and so on. So, most essential component of exercise is maintaining good nutrition and sleep. Most important two things what we need to keep in mind. So, a refreshing sleep, adequate rest, and recovery are integral ingredients for fruitful benefits of exercise and recovery. And remember what we're sitting and talking now. Sitting is considered as the new smoking, and I'll come to all those things slightly later. So, exercise utility, lot of question comes as I showed you in my disclaimer. It's one of the most controversial topic you could ever think of presenting. And afternoon exercise is more efficacious than the morning exercise. Many of the diabetes-related trials have shown it. A good walk just after your lunch or after any meal is good. And afternoon exercise has shown to be better with respect to reducing the post-meal excursion of sugars. Higher intensity exercise is not more effective than the lower intensity, but on a whole, again, it is a controversial statement. On a whole, there is exercise dose curve response. Sometimes, when you double the what WHO says, still it gives beneficial, but beyond certain point, you don't have to really run a full marathon or do an Ironman race to prove you are fit. Beyond 1 hour, 1.5 hour, beyond that, it may or may not benefit to that extent what we see in a person who do not exercise. So there are a lot of protocols for it. A SIT protocol, which it says sprint interval training, means intense exercise, short bursts with a total commitment of 30 minutes or even lesser is as effective as going on for an hour or more. So, resistant training, that's an important thing. Previously, exercise, 9 out of 10, we meant that we just go for a walk or jog. But nowadays, a lot of evidence has come, especially with respect to diabetes and also obesity, that resistant training is very important because of one entity, especially in us, in Indians, is sarcopenia. Sarcopenia means we are referring to the muscle mass of the body, which could be much lesser in Indians as compared to the Caucasians. So, and this muscle mass, if you don't build it, with age, you start losing it. And this loss could be much more in Indians as we grow older. So, this resistant training has gained a lot of importance of late and is getting into the guidelines for exercise to be importantly inculcating resistant training along with balance and yoga. So, we are in an era of evidence based medicine. Everything we want evidence. Someone may joke, why should you really have an evidence for exercise? It is prudent or it's a common sense to know that. But still, if you look at, there's a lot of evidence for exercise. We know that there's an inverse relation between prevalence of dysglycemia with respect to higher quality of physical activity. That is, if you look at the prevalence of diabetes and mark physical activity on the scale, higher the physical activity from 11% to 16.8%, the prevalence of diabetes also comes down. So, in a light exerciser or a sedentary worker, the prevalence of diabetes could be 17%. And if there is a heavy worker or moderate to heavy worker, the prevalence could be 11 to 13%. So, there is definite evidence for that. Both combining aerobic and anaerobic exercise is always a good idea, and it has shown superiority to either modality. And it also says that we should always mix and match. And if you do something very repetitively, it happened to me also when I started running. I was running most of the days and I was getting injured. So running or doesn't require to run all the time. You have to build your muscles, improve your flexibility, improve your balance, and keep your mind relaxed. So all parameters are encompassed into exercise. So what happens when we do exercise as per the guidelines? There's definitely a reduction of weight, also the waist circumferences, visceral adipose tissue. That is, the central fat comes down, blood pressure, both systolic and diastolic, improve, and average A1C, the HbA1C can reduce from anywhere. A lot of exercises are shown from either zero point 0.6 to 1.1 reduction of HbA1C, which is equal to many of the medications which are available for the treatment of diabetes. And of course, the LDL, the low density lipoprotein, which is the offensive lipid, also comes down with respect to doing exercise. Definitely, it improves insulin sensitivity as early as 48 hours. You start your exercise within 48 hours, the insulin will work better than what it used to work. But most importantly is this last line. What they say that exercise acute effects start waning in 2 to 3 days. That's why the guidelines have designed not to have a break of exercise beyond 2 days. So we say at least 5 days a week we should exercise. Again, there are a lot of controversies. We mentioned about afternoon exercise to evening exercise, and what are the exercises which helps the cholesterol as compared to the glucose. So many studies have shown that post-meal exercise, as expected, improves the glucose uptake by the muscles and therefore benefits glycemia more. And fasting exercises helps lipemia. We all know the lipid production is mainly maximal at late nights, and especially that of triglycerides are put out by the liver, and that gets benefited if you do an exercise in empty stomach or fasting state. Another important thing is flexibility and balance. What is balance exercise? If you try and make your patients or you do the exercise to on one foot, walking on the toes or on the heels, walking backwards and walking sideways, or running backwards and running sideways also we use when we work out and when we prepare for long runs. So that will also improve the balance, and also it strengthens the antagonistic muscles. Sometimes when we focus on only anti-gravity muscles, when we start doing these things, the other group of muscles which are antagonistic also gets strengthened and improvement in balance happens. And sometimes when you do an intense exercise like heavy weightlifting or sprinting like a 100-meter dash, you can increase your glucose. So make no mistake about it. We know that exercise can reduce the glucose, but burst of intense exercises can increase the glucose also. Again, we can use this parameter for our benefit by trying to do these exercise of sprinting and heavy weight lifting to avoid hypoglycemia in diabetes. We'll come to that later. Again, most important, as I mentioned, sitting is the new smoking. If you can see, this is my clinic where I'm sitting and talking now. I use this yoga ball on which I can sit, and I sit probably 2.5 to 3 hours in my clinic, and I don't feel any discomfort. And you just have to get the positioning right with the foot resting and the spine erect. It activates your core, and also it makes you get up and move towards the patient, and it also improves your practice. People get inspired by what you're trying to do, avoiding sitting, and also meeting the people, greeting the people. You go to the door and receive the people because it may not be very comfortable. So if you are sitting like a chair, which I've used it, shifted it down, I don't feel like getting up as easily as if I'm sitting on the yoga mat. So that is the important message again. Of course, nowadays there are tables and desks which are available, which can be standing and used it. Many companies, even many clinic consultancies do this also. So sitting is the new smoking, and there are trials to show interrupted sitting is very, very beneficial. Very important entity. I think one of the new entities in exercise is soleus push-ups. This is the soleus muscle, gastrosoleus. Gastrocnemius two heads, and in between will be the soleus. And as we read in MBBS, it's also called as the peripheral heart, the calf muscle, the peripheral heart. So it can go on and on. That's why it is called heart, isn't heart never stops. And if it stops for a long time, and that's the end of it. So why is this so different? Soleus contributes to less than 1% of body weight, but it can raise our metabolism 2 to 3 times as compared to others, and also improves VO2 max, that is the oxygen extracting capability of the muscle. In the sense, there is a certain amount of oxygen. If you exercise better, when you exercise better, the pulse comes down, BP comes down, but stroke volume increases. That's why the body can maintain it. Similarly, with respect to respiratory, when we exercise, the oxygen extraction from the blood can improve a lot, and that increases your performance. And it also elevates the basal metabolic rate because it has a slightly different type of muscle called the slow twitch muscle fibers, or the type 1 fibers. They fire slowly and they can go on for a long time. I've done a lot of runs, including half and full marathons. Most of the time, I cramp anywhere else, but not so much on the calf muscle. Isn't it? Many of the runners or exercisers can see. Many times you cough on the thighs or quadriceps or the hamstrings and so on, but less likely for the calf muscle to get cramped. And they have done a unique experiment, Soleus push-up workout, where they did it for 4 hours and resulting in less 52% less glucose excursion, because it draws glucose towards itself and also the other muscles, improves the glycemic variation also. And we are doing a national study on it actually. Shortly, we are going to begin with this, and many of the esteemed colleagues of mine all over the country are a part of it. So this is one of my video exclusively dedicated to Soleus push-up. You can go through it. And also, this is a conversation with my friend and also my patient, you can say. So she says that she did Soleus push-up 3 to 4 times, 5 minutes each session. And if you can look down, her sugar came down by 50 units. So Soleus push-up, we have a lot of evidence, and we are further building the evidence shortly by doing a large RCT, nationwide RCT on this. And now coming to most important component, many times forgotten component. Many times when people talk on exercise, they forget to talk on yoga. First thing is, yoga is not an exercise alone. It is much more than an exercise. For example, when I'm running, honestly, I'm thinking something else. I don't know how I'm breathing. Many times my friend has told you breathing very heavy. And my body posture, of course, we are a bit conscious, but not always conscious about it. But if there is something which can get your mind, body, and the breath in sync, can look at all the five sensory organs and connect it to your consciousness by chanting some mantra, that is yoga. And does yoga have evidence? Yoga have a lot of evidence. I think that slide is hidden behind that slide. There is enough and more evidence. Even we have published our one more paper recently on yoga, which was done for 1 year. Blood pressure, vitality, glucose control, even muscle strength improvement can happen in yoga. So, what is the difference? If someone asks me, what is the difference between yoga, walking, jogging, strength training, gardening, dancing, cycling, the various forms of exercise, everything is exercise. And I think this slide would bring you the answers for it. You divided it into aerobic component, resistance component, flexibility, and the balance component. So you can go through it. And the one which ticks most of it is yoga. And as I was mentioning, variety is the key to the strength training, to the endurance training by running or cycling, improve your flexibility by doing some yoga. And of course, I've not seen meditating there, but I think I need to do that a lot more. So it's not my saying. Even the American College of Sports Medicine has said this. Similar to a drug, exercise has to be prescribed in a modality, dose, frequency with a personalized patient approach. That is called precision care. So when we write a tablet, sometimes we take it before food, after food, half an hour, 1 hour, don't eat anything. So we tell patients so many things, and this could be the side effects. Similarly, when we do the exercise as the prescription, we should look at all these parameters. There could be some side effects of exercise also. We'll come to that. So, what are the concerns? There are a lot of people who debate diet is more important or exercise is important. Both are equally important. But one to one, if you look at it, diet is actually more important with respect to bringing down the metabolic parameters. But I can easily differentiate a day when I have exercised and not. Because when I exercise, I still take the states. I resist having junk foods. But if I don't do the exercise, because of the exercise secreting a lot of neurotransmitters, happy hormones in the body, you tend to do more healthier things and you tend to look more happy. So both are working in sync. Pre-exercise checkup is very, very important. Definitely, we have seen some instances of some celebrities become more famous, even otherwise, even some doctors succumbing to while doing exercise. But did exercise kill them? I don't think so. We'll come to that on what has to be done later. Mind over body, yes, it's a very, very important statement. When we start running or cycling or swimming, we will have, or doing an Ironman, we start having initially, possibly someone may say an unrealistic goal. A person who was sedentary, I started it doing in my 40s. I couldn't walk, but I started running full marathons. So that's the mind over body concept. If you put your mind and body will fall in place. But then we should be very careful also. We should respect the body also and never compete with anyone else. There are a few of my friends who run double my speed, but they are there and who am I is I am. So my situation, my body is different from what they are. So don't try to compete with anyone. Definitely slowly, steadily improve. And exercise paradox, of course, even there are signs to say that some instances of rhythm abnormalities, especially the atrial fibrillation, can be seen more commonly with people who are doing over exercise, not generally in moderate to severe intensity, but much more than that. And don't ignore the warning signs. If some pain is there, or some chest pain, or some discomfort, please don't treat, even if you are a doctor. I'm saying that. So if you are, even if you're a doctor, don't treat yourself. We know that traditionally we don't have to treat ourselves and our close family members. It's better to consult someone else, maybe your friend or colleague. Better to do. So when we're talking about exercise and glucose, because some aspect of the talk has to be dedicated to diabetes, these are the factors which affects glucose response. What is the duration of exercise, intensity, and type of exercise? I told you, if you do an intense exercise, your glucose can increase actually. What is the prior metabolic control? What is the current glucose level? And what types of medication, not only insulin, other medications, what he's had, which can increase the risk of low or high sugars. Because when you start exercising and when you're moving the body, the insulin absorption especially can vary also. And also it depends on the muscle mass, how conditioned he is, what degree of stress he has, and what is the timing of the activity. I showed you in the initial slides that post lunch could be better for diabetics, post meal could be better for diabetics. But is it possible, feasible for everyone to do that? So when someone asks me that question, I always tell try and do it whenever you can in a more relaxed way rather than pushing it to that certain way because we are also have to factor what we are doing in life. So blood glucose monitoring, I think this chart is available in most of the slides or on the website. You can take a photo of this. If it is less than 100, when you do a finger prick or nowadays the continuous glucose monitoring sensors, if it is less than 100, people generally say recheck and do the exercise with a glucose load, 10 to 15 gram carbs. If it is more than 250, And if there are ketone bodies present, definitely no exercise. And if someone's sugar is more than 350, irrespective of presence of ketone bodies, exercise is a relative contraindication for that. And always you might have to take multiple readings, especially if you're doing a simple walk, may not be that intense to recheck your blood glucose. But if you're trying to do something more than that, or a marathon or whatever, more intense exercise, it is better to go on CGMS if you can afford it, or few readings, up to 6 readings a day, or more or less based on how you will understand, and you can know your body better when you what type of response your glucose does when you do the certain type of exercise. Most important in diabetes, the rate limiting step in diabetes management is that hypoglycemia, means low sugar. So definitely it's very important for all of us to know that low sugar is a serious consequence, especially post exercise. It can happen, especially if someone is exercising late night or late evenings and they don't have a good meal after that. Their risk of nocturnal hypoglycemia could be much higher. That's why we emphasize on graded exercise in people who are diabetic. Slowly you start. You start with a 2-3 minutes walk and then build it up. There's no hurry. You can build it up slowly. You can build up the time or the speed or the elevation or mix it up. Do yoga. If you're finding it difficult, do the Soleus push up. Actually, whenever I give a physical talk, I always tell them till I finish the talk, you should continue to do the Soleus push up, which is very easy. Just this is your foot. You just lift your heel up and down without touching the ground and keep repeating it. That's the Soleus push up. So, this is important to avoid hypoglycemia in diabetes. Again, I told you some brief maximal intense sprints or weightlifting can cause hyperglycemia, and this can be utilized as an advantage. So, if someone does a long run or a long walk, you end up with a short sprint at the end of it. Or try and do some small weightlifting. You don't have to lift heavier weights. Even a simple 2, 3, 5 kgs is good enough. And then that can annihilate the effect of exercise causing low sugar by increasing the glucose. So again, another important aspect is you can have a small bedtime snack. Again, you should be careful what you have. You could have a fruit or a buttermilk, or if the sugars are low, you can have anything more which is having carbohydrate in it. And importantly, relook at your exercise pattern, relook at your medications, and discuss with your doctor. Fluid and electrolyte is very, very important. In Bangalore like place, especially in December, should not be much of a concern. I may lose much less fluid in the form of sweat. But next month I'm doing the Mumbai Marathon. It's a different ball game. Of course, it's not very hot, but it's definitely humid in Jan in Mumbai. But then you may lose much more salt and water. So the sweat rate can vary from zero point 0.5 to 1.5 per hour, 1.5 liters per hour. Each person is different. What we generally say is before the start of exercise, up to half a liter of water with some small intervals, you can take it, not gulping down. And when you are working out, continue to take small amounts of water, salt, electrolytes. People, if they are very interested, they can go on for this commercialized drinks, which I'm not a big fan of, but you can choose it based on your requirement. So it could be very varied. Someone may sweat a lot less, someone may sweat like much more, someone may lose less salt, or someone is preparing well. The loss of salt also could be lesser, even though you had sweated a lot more. So they will require more water than the salt supplementation. Of course, potassium also should be kept in mind. So coming to the recommendations. So far we have looked at what are the types of exercise, what could vary, how it has an impact on the glucose. But the recommendations, if you look at it, in children they say almost an hour a day, 5 days a week, moderate to vigorous intensity, and also include strength training in it. For adults, 150 minutes spread over a week with no more than 2 consecutive days of break. So Saturday, Sunday, or whichever days you can take it. Prefer to take 1 day break and then do the next day, because as we showed, most of the benefit starts waning from 48 to 96 hours. Always engage in resistance training at least 2 days, again non-consecutive days, and most importantly, don't keep sitting. Sedentary behavior should be avoided. Prolonged sitting should be interrupted by walking or just do the Soleus push up when you're sitting. Flexibility, yoga, and Tai Chi are also very, very important and should be involved 2 to 3 times a week. So, this is the recommendations what we are looking at it. 5 days a week, at least half an hour to 45 minutes, mix and match, involve resistance training, weightlifting, yoga, flexibility, meditation also should be there at least twice a week. That is the WHO recommendation. Fit for exercise, very, very important, especially after lot of reports that many people have succumbed to exercise and so on. So we should firstly, when a patient or when you're recommending to a colleague or your own self, always assess your risk. How bad is our family history? What are the risk factors we have? How good is your sleep? So categorize them with high risk or low risk. Most important is second one, mindset. If someone is not bothered about it and I'm going on and on talking about exercise, they will not be bothered about it. So first you look at the person's intention, whether he has any intention to do exercise or not. Then you just have to talk to him to make sure and sensitize him the utility and get an intention which is right. There are some people who have intention, but they're not doing much. There are some other people who are having some activity but not up to the mark. And some people are very well disciplined and for years together they are doing the exercise regularly. Gadgets and apps could be mostly positive, but sometimes could be negative also. People are glued to it. He ran this much in that much time and so on. There is a nice thing nowadays which has come up, which happened to me also called naked running. Don't mistake me, it's not wordly taken, naked running. Naked running is nothing but you go or a run or a do your exercise without any gadget. So when I was running or when I run, it's a very natural tendency to look at my heart rate is this much and this at space. Oh, the last kilometer I was doing better. Now I have slowed down. So many things happen that you defeat the purpose of enjoying what you're doing. So very important is to enjoy what you're doing. So even now I do sometime, but many times nowadays I prefer this not to take any gadget,